June 26th is the International Day Against Drug Abuse and Illicit Trafficking. A recent report on drug trafficking and consumption in West Africa highlights that the region's governments need to make more efforts to tackle the issue. 43-year-old Arsène Touré is a carpentry teacher in Abidjan, Côte d'Ivoire. He says before teaching carpentry, he lost much of his life to drug addiction.
I practically spent almost 15 years on the streets. I immersed myself in drugs. I didn't listen to the advice from my parents, and that's how I ended up on the streets. And I was even in prison. I spent 10 months in prison, and when I got out, I really didn't know where to go.
At Abidjan's Remar Rehabilitation Center, cocaine addiction is one of the most common reasons people seek treatment at the Spanish-based Christian NGO. Fernando Ribeiro is the head of the center. He says in 2005, the center began to see a significant increase in drugs in the area.
This region is completely full of junkies. People not doing absolutely nothing, only be destroying itself.
Remar has centers in 7 towns throughout the country and conducts outreach programs in prisons and junkie dens. More than 600 people take part in Remar's programs, and around half of them are there for drug addiction. Roche Emmanuel Zoussou started smoking marijuana at 15, but then a friend introduced him to crack cocaine. He is now 61 years old.
I did not have any strength left. Cocaine became like medicine for me. I had to smoke to wake up. I had to smoke to get out of bed. I had to smoke to work. I had to smoke to teach. Cocaine took over my life. My house is empty. It was really expensive.
In Senegal, at the Sopijiko Treatment Center, recovering addicts are treated using art therapy as well as through group support. Bakay Ndour says he was using drugs for nearly 15 years and the treatment probably saved his life.
If it wasn't for the center, I really would have gone crazy or died in the streets, or been attacked, or would have become a violent criminal, a thief.
The West Africa Commission on Drugs released a new report advising the region's leaders to decriminalize lower-level drug offenses, saying drug users need help, not punishment.
We must punish the people who are selling right now for concerning the people who are in prison because of drugs. I think we should put them in specialized centers and try to show them the cost of using drugs.
Yes, we must put them in rehabilitation centers so they can get better and go back to their homes, reassume their household duties and family duties.
Experts say by looking at drug use as a public health issue, regional governments can move drug users out of jail and focus on putting the drug traffickers into the prisons where they belong. Joining us via Skype from Cape Town, South Africa, is Quintin van Kerken, founder of the Anti-Drug Alliance of South Africa. Mr. van Kerken, welcome to the show.
Thank you so much for having me.
So the report focused on drug trafficking and abuse in West Africa. Can you give us a sense of the issue of drug abuse in your country, South Africa?
South Africa at the moment is in a massive epidemic. We're almost in a tsunami, if I could put it like that. Basically, what's happening is that we've seen just a tidal wave that has hit us. Unfortunately, what the government has done in our country is tighten up legislation, which hasn't necessarily fixed the problem. It's in fact made it a bit worse at the end of the day, because now it's just driving the people more and more underground. A very prohibitionist approach that they're taking, and it's really not working in our country.
Now, you started the organization after a personal experience with drug abuse. Is there a medical reason to why people become drug addicted?
Well, you know, with addiction, it's a multifaceted thing. You're never quite sure what the root cause of addiction is. But most of the time, what we like to say is that people begin by experimentation, and at the end of the day, get addicted. We're never quite sure when it happens, but it goes from experimentation to abuse, where people are just using drugs to feel better all the time because of their circumstances or whatever the case may be. And drugs then become a coping mechanism to actually get through the day on a daily basis.
You have recovered for many years now. What steps are involved in recovery for someone to really stay away from drugs for a long time, as you have done?
It's very difficult because treatment there's so many different types of treatment available out there. What we're seeing is the traditional rehabilitation, as we know it worldwide, is not really working very well. Recent reports from academics have stated that in South Africa it's about a 3% success rate, which is terribly low. However, we've been looking at different models. Our own program that we run has got a massive success rate. It's just over 60% of people coming into our program that leave it and stay clear of drugs for at least a year or more. The reason for this is that it's very, I beg your pardon, I had the frog in my throat. We tailor it to the person.
Okay, Quintin, thank you so much for joining us today from Cape Town, South Africa.
Thank you so much.
And that was Quintin van Kerken, the founder of the South African Alliance for Drug. And that's our Africa Health Report for today.